The Colloquium is the new generation of the Center for Forced Migration Studies, and we work to broaden our understandings of the realities of refugee flows, asylum seekers, conditions of statelessness, internally displaced peoples, and development climate-induced migration. My co-host for this series is with us here today too. That's Deniz Duriz. She's a postdoc fellow with our Northwestern Cayman Modern Turkish Studies program. This webinar series is made possible through the assistance of Danny Postel, who's the assistant director of the new CIAS, and Cindy Pingree, who provides administrative support to our faculty research groups and have been administering the webinar series brilliantly, I might add. Okay, so while those of us within the United States in our homes alone or with loved ones wish we didn't have to be participating in this global-wide stay-at-home orders, millions of refugees around the globe have no home and live in crowded UNHCR or state-run refugee camps, in detention centers and makeshift urban tent cities without access to clean or running water and in crowded living conditions. For hundreds of thousands of others, the slim hope of being reunited with family or being granted resettlement is now gone in the face of travel. COVID-19 has enabled the Trump administration to hasten its resolve to cut our refugee and asylum humanitarian program. Drastic measures have undercut our long-standing commitment to refugees and asylum seekers in need of protection. Through this series, our hope is to raise community awareness by bringing you speakers from the front lines, advocates, practitioners, and refugees who can fill you in on their situation. Prior webinars brought information about the in East Jerusalem. Next week's webinar features speakers from the Join Together project in Toronto and how they're providing social support in times of changing Canadian resettlement. The final webinar for April will be about refugees in Brazil. So today, we will hear how Chicago's refugee community has been impacted by COVID-19 and the larger impact the pandemic will have on the US refugee admissions program. The format for today includes 7-minute introductions by our speakers. I will then moderate a conversation with our speakers. We will then open the forum up for participant questions. Before introducing our speakers and turning the Zoom mic over to them for their introductions, my co-host Deniz will say a few words about how participants can pose questions for our speakers through the chat. So take it away, Deniz.
Hi, everyone. Welcome to our third webinar in the series. I'm Deniz Duriz. I am a sociocultural anthropologist, and I work with migrant farm workers from the Kurdish region of Turkey and Syrian refugees in Turkey and in Europe. At Northwestern, I'm the postdoctoral fellow of the Cayman Modern Turkish Studies program, as Galia noted, housed under Buffett Institute for Global Affairs. And finally, I'm one of the co-organizers of this colloquium, and I will be hosting the Q&A session for today. Please, throughout the session, if you have questions, post them in the chat box. And then after we have the moderated questions, I will be collecting the questions and ask them under one theme. So without further ado, we're back to our speakers.
Thank you. Three members today.
I think I should take over,
and refugee rights.
You're delayed.
Oh, am I delayed?
Oh, now you're back.
No,
Okay.
I think I'll be okay. Okay, no, I think I'll be okay. Okay, so in this, you're also kind of delayed here and there. I think we're good. Okay, so in this position, Fred provides technical support, trainings, presentations on immigration-related topics to service providers, immigrant community organizations, and others who work with immigrants. He also provides updates and analysis and changes policies and procedures to ICIRR and assist with the coalition's legislative advocacy efforts. Okay, we also have with us today Suzanne Akhras Sahloul. She's the founder and executive director of the Syrian Community Network. SCN has grown exponentially to become a strong voice for refugee and immigrant rights and national community-based resettlement organizations, working in partnership with local and national refugee rights and faith-based organizations. And finally, we have Jims Porter. Jims is the manager of Communications and Advocacy at RefugeeOne, Chicago's largest refugee resettlement agency. What Jims does is he works to raise awareness about refugees through community education, media engagement, and advocacy at the local, state, and federal levels. So we're going to start, I believe, with Fred. And so Fred, you have 5 to 7 minutes to give us an introduction about your work.
Okay. Thank you, Galia. Thank you, Dennis, Danny, and Cindy for facilitating all of this, and thanks everyone for being on the webinar today. My name is Fred Tsao. I'm the Senior Policy Counsel with the Illinois Coalition for Immigrant and Refugee Rights, and I wanted to take a few minutes to provide a kind of higher level overview of how the federal government's response to the pandemic has affected refugees and asylum seekers. First thing to know is that those seeking refuge from outside the United States are essentially locked out. Galia mentioned this in her introductory remarks. We know that refugee resettlement has been devastated over the past 3 years or so, down from historically high levels to now historically low levels. And now with the pandemic, refugee resettlement has shut down altogether. And this even includes refugees who are following to join other refugees, other family members who have already been resettled in the United States. So those refugee families remain separated for the duration. We've also seen essentially asylum processing shut down as well. Now, asylum processing, particularly at the southern border with Mexico, had already been severely limited over the past 3 years or so, with policies such as metering, limiting the number of people who can present themselves at ports of entry. The migrant protection protocols, or what's better known as Remain in Mexico, which essentially requires people who present themselves at the southern border to remain outside the United States for the duration of their cases. And third country agreements that require people who pass through other countries on their way to the United States to have first filed for asylum in those other countries. Now, with the pandemic, non-essential traffic from on the northern and southern borders is essentially shut down. People crossing the border or presenting themselves at border checkpoints are essentially now being turned away without any further opportunity to present their cases or make their claims for humanitarian protection. And just in the last several days, there have been reports that Customs and Border Protection, who would ordinarily be taking refuge seekers into custody, have now undertaken a massive expulsion of thousands of people who had been in their custody to the point now where CBP has only double-digit figures of people who remain in their custody. I should note here as well that many people who have been able to make their applications for asylum remain in immigration detention. And while in detention, they remain susceptible to pandemic outbreaks, as we have seen in a number of ICE detention facilities already. In very close quarters, and in many cases in lacking proper hygiene or other equipment that they need to maintain sanitary conditions. So I did want to note that there is actually some good news in this, insofar as people who have been resettled as refugees or people who have won their asylum claims are eligible for many forms of the relief that the federal government has legislated over the past several weeks or so. Refugees and asylees are by law eligible for most public benefit programs, including the SNAP program, formerly known as food stamps, as well as Medicaid. And I should note here that this is in contrast to many immigrants who more recently received their green cards through family or employment relationships, who are otherwise subject to a 5-year bar on benefit eligibility. So this means that refugees and asylees are able to get Medicaid coverage for COVID testing and COVID treatment as well. Also, because refugees and asylees are authorized to work, if they lose their employment, they are eligible for unemployment insurance benefits. And because they're authorized to work, they should have been able to get Social Security numbers, which means that if they've used their Social Security numbers to file tax returns over the past couple of years, then they should be able to get the what the IRS is calling the economic impact payments, more commonly known as the cash relief benefits or the tax rebates, the $1,200 per person or per head of household payments that many of us should be receiving over the next few weeks. I should note, though, that there are some exceptions. First off, those individuals who have not filed tax returns for either 2018 or 2019 will need to file something in order to receive their tax rebates. Also, many asylees may be, and for that matter, many refugees may be in mixed status families. They may have spouses or children who do not have Social Security numbers. And if that is the case, and those individuals were listed on their household tax returns, the entire household, unfortunately, is disqualified from receiving the tax rebate. These are issues. These exclusions are issues that need to be addressed. Many of us, ICIRR and the Golden Door Coalition, are advocating for relief to be extended to all U.S. families. Not just those who have Social Security numbers or who've had work authorization. I should add one further note here, and that is that refugees and asylees rely very heavily on resettlement agencies and other community-based organizations. In many cases, these agencies, these organizations arose out of the refugee and immigrant communities themselves as mutual aid associations. In other cases, these are the organizations that assisted with the resettlement process. And in either case, refugees, asylees, and other immigrants rely very heavily on these organizations for good information, for classes, for education, and for other forms of support. And this is particularly crucial in these times of the pandemic, where getting good information out about health risks, about available resources is all that more important. It's particularly important with respect to refugees because refugees may not speak languages that are fairly common within the broader community. So having that kind of language access is all that more important as well. Unfortunately, many of these organizations have experienced severe budget cuts over the past few years. Refugee resettlement organizations, in particular, receive funding based on new refugees who are resettled. And because refugee resettlement numbers have been so devastated over the past few years, the funding flows for those agencies has also taken a huge cut. So, we are hoping that when Congress comes back for another round of relief efforts, that refugee resettlement organizations and other community organizations are strongly considered for assistance, from the federal government. We're also hopeful that state and local governments can also provide that form of relief. So I'll stop there and turn it back over.
Thank you, Fred. And that was a very comprehensive and full of information about our programs that have already been under attack and only more under attack now with the pandemic. Suzanne, do you want to provide an introduction now?
Oh. Suzanne, you're muted.
Mute myself. Okay. Hi, everyone. Everyone can hear me now? Can you hear me?
Yes.
Okay. Oh, great. Okay. Hi, everyone. I'm Suzanne. I'm the founder and executive director for Syrian Community Network. We are a community-based organization, refugee support for mainly Syrian refugees who have come through since 2015. But we serve everyone who walks in through our door. Everyone is welcome. So I did a few slides that I wanted to share with everyone. Hold on, I have to figure out how to do screen sharing. So that's my only, I always have this share screen. Okay, oops. Okay, start from the beginning. Okay, can you see my screen?
No, we can't.
Oh, let's see, where is it? Okay. So you still can't see it? Okay, share screen. This one.
Do you want us to have Jim present first and then we can come back to you?
That's fine. I'll just speak without the slides.
Okay.
So as I was saying, we started the organization in 2015, and the services that we have are case management. We work with our clients to, as Fred mentioned, about all of the state benefits that they can receive. Right now, we've switched mainly to focusing on unemployment and applying for jobs for our refugee clients. We also host an after-school program, which has now switched to online learning. And we also do a lot of workshops for family well-being support, and talking about issues that, domestic violence, safe behavior for teenagers. We have a teen focus group specifically for that. And then an elderly program as well. And we're hoping now we're going to be starting our immigration department pending, funding sources, of course, because we recently we received the Department of Justice approval so that we can do citizenship and immigration work for our clients, which is really exciting for us, and we're happy to do that. But through this COVID pandemic, what we have really tried to do is focus on providing information and resources that is language accessible, because a lot of the information that's coming out concerning different communities is in English, and people don't have access to those resources, and they don't really understand what these, all of these tips and advice that are being given out. So we've been really focused on getting information out in Arabic for our refugee clients. Many times you have to repeat things over and over, because a little bit the attitude is that, well, we've seen it all. We've been through everything. As you know, Syria is the worst humanitarian crisis that we'll see in our lifetime. Hopefully we'll never see another one like that. And the crisis is still ongoing, and many of them are dealing with family members and people who they know are in refugee camps. And as we know, refugee camps are not the safest place to be before COVID, but now with COVID, this is going to be extremely difficult with social distancing and all of these precautions, washing hands with water and soap. So a lot of our families are coming to us and asking us, how can we help and what can we do? And so we're trying to really be supportive and listen to their concerns and about their family members overseas. But at the same time, we keep insisting that we have to be proactive here. You're now here, and you have to stay safe, and your children have to stay safe, especially now that Ramadan is coming up, and this is the time for community gatherings, for many big iftar. People like to invite friends over when they break their fast. We call it iftar, and we, people like to, the more generous that you are, the more people that you invite. In our faith tradition, we believe that this is part of our that we receive more blessings for the all of the things that we share with other people. And so this will be a very difficult time for them, because, you know, if you do an iftar, you have to do it over Zoom probably, and there are no nighttime prayers, and those are things that help you get through the long days of fasting. So we've been really trying our best to share information videos in Arabic. We've been trying to do, you know, I've been asking my husband to do, you know, 2-minute videos here and there, and I post them on our Arabic Facebook that we have specifically for our clients, and we're using WhatsApp to communicate with them for that information. We're also working with Mira, because they also have, they serve mainly Iraqi.
Suzanne, can you just say the full name of Mira for people who don't know what that is? Go ahead.
Sorry, it used to be IMAS, which is the Iraqi Mutual Aid Association, but now it's Mira is Middle Eastern, I'm sorry, I don't want to mess up the name.
Middle Eastern Immigrant and Refugee
Association, right? Yes. Okay. Yeah. I'm sorry. Yes. And so they work with mainly refugee clients from Iraq, and asylees and SIVs. And so we've been also sharing that information with Laura, their executive director, so she can send out that information. It's very difficult sometimes to get through to some of our clients, because, as I mentioned, many of them have said that we've seen it all. You know, we've lived through bombing, we've lived through all these things, but we keep insisting that you still have to take all of the precautions. One thing that we were noticing that, you know, when they say, you know, you can go outside and go out for a walk, you know, somebody, one of the parents had called us, and she said, well, is it okay if my kids are playing in the park with other kids? And I said, no, they can't. They can, but like, really, you have to be far away from each other, you know. Please go outside and make sure that you, you know, watch them, and you know, so that they're not in too close proximity. So this has been a little bit of a challenge, but I think it's getting through. We're focusing right now, our main thing is to make sure that our clients are receiving the benefits that they need, whether it's applying for unemployment or increasing their SNAP benefits, or whatever the case may be. We're trying to connect them to resources if they need additional help through religious organizations, through mosques, you know, for zakah. Zakah is the charity or tithing, each mosque has like a committee like that. And so whenever they need extra resources for some families where we feel that are vulnerable, we've been referring them there. Yeah, and it's just been, you know, I think it's just been overwhelming for many of them, because they've lost jobs, or especially if they drive Uber or Lyft. And this is something that, you know, we have to, I think the next phase, once we get out of this, one of the things that we've been insisting on with our clients, that you can, Uber and Lyft, with all my respect to everyone who drives Uber and Lyft, they're great for additional supplemental salaries, but they're not a career. And we were trying to push them in the direction of getting certificate programs so that they can kind of expand their horizons. So this is something that we've had clients now come back and tell us, remember when you told us this, we should have listened. So this will be the next challenge, I believe, so that we can get them on a path to steady work. And God willing, we'll all get through the pandemic together. Thank you, Galia and Danny and Denise and Cindy, for organizing this.
Thank you, Suzanne. So Suzanne has given us this perspective of one of the many organizations that work here in the city of Chicago, and hers is one of the newer organizations, along with the Rohingya Community Center, which is on Devon. We couldn't have everyone on the webinar today, so thank you, Suzanne, for representing the mutual assistance associations that are part of the vibrant and strong community network in Chicago that support refugees and asylees. Jim's Porter is with a refugee agency. So Jim's, do you want to take over and give us your introduction now? Thank you.
Sure, thanks, Galia, and thanks to everybody who's helped put together this webinar. I'm really excited to be here to talk a little bit about some of the ways refugees are experiencing the impacts of COVID-19, and how communities and the refugee community in Chicago specifically is coming together to support those impacted by the pandemic. Wanted to start just by, talking a little bit about RefugeeOne, which is the agency I work for. RefugeeOne is Chicago's largest full-service resettlement agency, and it's our mission to create opportunity for refugees fleeing war, terror, and persecution. These very people that Suzanne and Fred have been talking about, to help them build new lives of safety, dignity, and self-reliance. So every year we work with about 2,500 refugees and immigrants, helping them really from the moment they land at O'Hare, welcoming them into Chicago and providing furnished apartments, English classes, job search support, mental health care, youth programming, and mentors and tutors to help them adjust to life in the U.S. Since we were founded in 1982, we've welcomed about 18,500 refugees to the Chicagoland area, and you know, we've experienced a lot of challenges under the past few years, as Fred mentioned, including cuts to the resettlement program, to refugee admissions, to funding for refugee services, and all of these things have kind of been amplified by COVID-19. Right now, we're seeing many refugees that we work with who are concerned about job security. They're experiencing unemployment and loss of income. They're worried about paying the bills and providing for their children. They're worried about family separation and what this crisis will mean for their family members who have not yet made it to the United States. Others are concerned about school and childcare closures, while others continue to work in essential industries that have been really heavily impacted by this pandemic. At the same time, there's people who need mental health support as well as physical health support to cope with new anxieties and to receive important information in their own language, including public health and safety information. One thing that we're seeing, and that Fred kind of mentioned, is that some of the most vulnerable refugees are actually slipping through the cracks when it comes to some of the relief packages that have been provided. And we'll dig into this a little bit more later in the webinar. But some of those challenges that folks are facing now as a direct result of COVID-19 are things that we're trying to alleviate through a Chicago-based coalition called the Golden Door Coalition. And just wanted to do a brief introduction of the Golden Door Coalition, of which all three of us, Fred, Suzanne, and myself, as well as Galia and others on the call are members of. The Golden Door Coalition has been in effect for been working for about 10 years, but was just recently reconvened last fall as some members of the resettlement community were talking about ways that we could focus on advocacy for refugees. And that timing was particularly apropos as it was kind of in lead up to what happened with COVID-19. And so we've been building the infrastructure of this coalition so that we can now respond to the immediate needs of refugees. So the coalition is a statewide coalition of refugees, community organizations, faith-based institutions, and lots of other people who are working together across Illinois to advocate for refugees and their needs. Our focus is really on communication, education, and advocacy. And we're committed to strengthening refugee families and creating welcoming communities and policies that are welcoming of refugees and immigrants. Obviously, our current focus right now is trying to provide relief in regard to COVID-19. We'll get into the components of our platform a little bit later. But some of the things that we're seeing immediately is that not all refugees are qualifying for the relief that's provided through the CARES Act. In particular, the most recently arrived refugees. And what's problematic about that is they're not only able to qualify to receive the cash payments that Fred mentioned, but if they've been here for a shorter period of time, they also don't meet the Illinois unemployment requirements. And so they're not able to file for special unemployment benefits. So we see these people who are the most recently arrived and often the most vulnerable because they haven't yet found employment or developed the language skills are now in an even more precarious position. And so that's what the Golden Door Coalition has been focused on recently is finding ways to respond to that.
Thank you. Thank you for that excellent introduction and also getting us going on talking about the Golden Door Coalition. So Jim, we'll start the moderated conversation, starting with a question for you. What role do you think the Golden Door Coalition can play given these challenges? Fred mentioned a number of them. Suzanne talked about, some of the direct needs of organizations like herself. And then you've been one of the people who's spearheading our Golden Door Coalition. So what role can it play in supporting refugees in Chicago? And are you reaching out also more broadly to groups and states, in other states or perhaps even in other countries?
Sure, that's a great question. I think there's a lot of benefits that come from the Golden Door Coalition. I think first and foremost, it brings together all of the major players in the refugee resettlement community, including resettlement agencies like RefugeeOne, mutual aid societies like the Syrian Community Network, as well as civic and community groups that are all working together to address needs specifically that can be met through advocacy. because there's kind of other venues in Illinois and in Chicago where we can talk about the services that refugees need. But this group is focused on advocacy and how we can have a space to ensure that all the systems that refugees have to interact with are sensitive to the needs of refugees that are very unique and constantly changing. I think one benefit that having a space like the Golden Door Coalition allows us is it allows us to kind of set the gold standard when it comes to refugee policy and make Illinois and Chicago leaders within supporting refugee communities through advocacy. In regard to staying connected more broadly to groups in other states and countries, we're staying connected with other organizations throughout the country, especially through our coalition work with other larger coalitions like groups like Refugee Counsel USA. Those are spaces where we can connect with other advocates and service providers to identify and share best practices. We're also looking for ways to expand our reach through traditional media outlets as well as non-traditional ones like this webinar. And those allow us to interact with people all over the world. Yeah, so I'll just start with that.
Thank you. You know, talking about refugees, and we hear about the devastation and how difficult it is for them. Suzanne brought up language barriers. Fred you've talked about challenges, different ones from the general population in terms of unemployment for people who've never gotten here but have never been employed. I know Mayor Lori Lightfoot recently said, you know, and this is also data from other cities, that the distribution of this terrible disease tells a story of resource inequality. And the data definitely shows how COVID is more deadly for minority populations who have more limited access to care and are facing economic hardship. But it sounds like, and if you could elaborate on how refugees within that minority population are an invisible group given their language barriers. So whether you or Fred or Suzanne or all of you, you know, what are the challenges of gaining visibility within the overall inequality that minorities face, and then how can the Golden Door Coalition contribute? Maybe Fred or Suzanne or whoever wants to start.
Fred, if you want to answer. And then I'll add.
I was going to toss it over to Jim's, but
I can take a quick stab. I think we've all got a bit to say about this. You know, I think one thing is important to recognize that the refugees are already on the front lines of those who are impacted by COVID-19. Not only are they working in industries that have been heavily impacted by layoffs and unemployment, like the hospitality industry, food services, and folks working in the gig economy, doing jobs like Uber, Lyft, and delivery services, but they also continue to work in essential industries like healthcare, supply chain work, food services, and the industries that are really putting themselves at risk for contracting this disease. They're considered essential workers. When it comes to aid and relief, I think the most vulnerable refugees, like I mentioned, are slipping through the cracks. The CARES Act does have a residency requirement that excludes the most recently arrived refugees, who are likely, like I said, the same folks who won't qualify for unemployment because they haven't been here for long enough periods. So those are a couple of the ways I think that, you know, that relief is being provided, but that the refugees aren't necessarily qualifying for.
Thank you. You know, one of the questions I have that I wanted to talk to you about is also one that's touched upon in the chat. So this is, I think, Fred, you'd be a good person to speak about this. You know, from a U.S. policy perspective, I know that I hear from regular people saying, well, we should temporarily stop, you know, the admission of refugees. It's maybe good to have the fact that, you know, we're temporarily doing these things. But there's a broader concern with that. And I know that someone in the chat is, you know, asking about the situation that when you're putting a pause on asylum seekers who are in the Chicago area, but they're paused, so they're stuck in a shelter or a detention center. Their lives have been put on hold. So from a U.S. policy perspective, what do you see, Fred, as the main consequences of this temporary restriction? It might seem like an okay health provision as a stay-at-home order, but is directly impacting refugees and asylees in particular ways.
Yeah, well, in one very specific way, you know, in-person interviews for asylum applications are on hold. They're not happening. Processing for many other immigration applications are also on hold because, in large part because of USCIS is not doing other forms of interviews, and it's not even taking biometric appointments, that is fingerprinting appointments. So for many applications that require fingerprinting, like green cards, like citizenship, even some visa renewals, those are also on hold, unfortunately. U.S. Citizenship and Immigration Service has set what may be an optimistic reopen date of May 4th, which is barely 2 weeks away from now. I guess we'll see what happens with that. A couple of possible solutions that have been floated, one's already been implemented, is in some cases, USCIS is reusing previously submitted fingerprints. These are more for work permits, but it's also being applied specifically to DACA. Another idea that's being floated, at least for people who are further along in the immigration process, is remote oath ceremonies or remote interviews. In particular for people who have pending citizenship applications and who are almost there, but just waiting for an oath ceremony. Why not conduct those ceremonies, those swearing-ins remotely, so that these individuals are going to be able to get citizenship and ultimately vote, this November.
Thank you, Fred. Jims and Suzanne, so Fred has been talking about asylum seekers. Refugee resettlement program has its distinct challenges. It's probably a lot to comprehend if you're on this webinar and you don't know what those different terms mean. But aside from what you've all been talking about, what do you want the public to prioritize? I think that there have been a lot of pitches and calls in the past because, as I mentioned, and as we've all mentioned, the Trump administration has already been gutting the program. So is there any different thing you want people to prioritize now in being able to support the work you're doing, Fred, at ICIRR, or the work that you're doing, Jims and Suzanne, in terms of supporting refugee resettlement? What do you see that people should be doing now? And then what do you see as maybe future needs after the current pandemic?
Go ahead, Jims, if you want to start, I can add to it.
Thanks, Suzanne. I was on mute. I think one thing that all of us would say, a couple things that all of us would say actually are first to support your local immigrant rights organizations, service providers, advocacy organizations, those who are on the front lines of responding to this crisis and helping those who have been really, really heavily impacted by it. So whatever you're able, look for an organization that meets your interests, whether it's Syrian Community Network, another member of the Golden Door Coalition, RefugeeOne, or ICIRR. Look for ways that you can contribute financially, because right now, given all of the federal cuts we've experienced and the looming needs of refugees, one of the biggest needs being rent, which is a really huge expense. And to be able to respond to the massive rental assistance needs that there are, we're going to need support from the community. So I think that's one way people can help. You can also support your local food pantries. Suzanne, maybe you can, I think, plug a couple that you've been working with. And of course, advocacy, calling your representatives and ensuring that refugees and immigrants are included in these relief packages, and that they're not overlooked, and that they receive the support they need.
Yeah, and just to add to what Jim said, and one of the food pantries that we've been working with and referring clients to is ICNA Relief. They're based in the north side and the west suburbs. Another one is the Moss Foundation Food Pantry in Bridgeview. So those are places that can receive donations if you have, if you want to donate canned goods, if you want to donate, any produce or anything like that, so that that for sure that they're going to needy families that are impacted by this. You can also volunteer with ICNA because they're looking for volunteers. They're extremely overwhelmed, and they're trying to get people or the food delivered to people's homes instead of having people come out. So that's another way to help. I think I just want to add to the one point when you were talking about how COVID-19 affects communities. One thing that that COVID-19 is showing is the disparity in healthcare, especially for wealth and the wealth gap that we've been seeing over the years. But this is really now obvious, and especially in safety net hospitals who are smaller, who don't have as much funding, and they are not able to provide the care or the service that low-income families need, whether they're refugees or not. So this is one thing that we've been something that we could advocate on later, of course, or now, in that these community-based hospitals and the low-income communities are not getting the resources they need to be able to, get the help and the need that they want. And it's really, it's showing this disparity in the city of Chicago in a really big level. And it really troubles me, and I'm sure it troubles everyone to see that. But refugees are especially hit hard because there was an article that came out in that said that the 48th ward or 49th ward were some of the most hit in terms of COVID, infections and things like that. So we really have to advocate so that refugees and low-income immigrants get the support and the healthcare that they need in terms of, whether it's more testing or whether it's, additional support in other ways, so that they can pull through this and get the information that they need to stay safe.
Thank you, Suzanne. Either Jim's or Fred, and we've been working on our own platform for the Golden Door Coalition. Can you share some of the main tenets of that, and then we'll open it up to the participant Q&A, which Dennis will moderate.
Fred, do you want to start with ICIRR's platform, and then I can talk about the refugee-specific components?
Sure, thanks, James. A few weeks ago, my organization, ICIRR, developed and published a COVID response platform. It's Everybody In, and you can find it icirr.org/everybodyin. So there are four main pillars to this. First off, healthcare access for all, making sure that everybody, regardless of immigration status, has access to COVID testing and COVID treatment or coverage for either, as well as adequate language access regarding health resources. The second is economic security for all, understanding the devastation being wrought by the associated, shutdown of the economy as a result of the pandemic. So making sure that affected families, affected households have access to basic income support, whether that's unemployment insurance or rental assistance or utility assistance, or other basic supports that are going to be needed, as well as appropriate language and cultural access for that information. Third is a particular concern regarding people in detention. We've seen with Cook County Jail and certain IDOC facilities and certain immigration detention facilities, as well as, I saw Susan's comment in the chat box, one of the Heartland Alliance facilities for unaccompanied minors, close quarters leading to COVID outbreaks in these places. So, what we want to emphasize with this is that we incarcerate too many people, we keep too many people in custody, in jails, in prisons, and perhaps unnecessarily, and putting them at risk. So let's figure out ways to ensure the safety of these individuals and flatten the curve for everybody. And then fourth, keeping people safe, by keeping people out of these detention facilities, which involves, trying to limit, immigration enforcement activity and other criminalization that leads people to being arrested and held in these detention facilities. So that's kind of the top line for ICIRR's platform. And I've been working with Golden Door on a refugee-focused platform that takes many of these principles and emphasizes the aspects in which refugee and asylee communities are particularly impacted. So let me turn this over to James for that.
Thanks, Fred. So I just start by saying that, the Golden Door Coalition is in support of ICIRR's platform, and many of our components are complementary to each other's platforms. I'll be submitting this in the comments section for anybody who's interested, but essentially our platform focuses on two main components in addition to supporting what ICIRR's already done, and that's to restore the resettlement refugee admissions program and to respond to the immediate needs of COVID-19. So in restoring the refugee admissions program, we're asking Congress to allocate funding to strengthen the resettlement infrastructure, to make up for some of the lost funds that we've seen in the past, but also to provide specific funding for COVID relief, including cash and medical assistance, housing and rent, utilities, transportation, and food and healthcare needs. We are also asking that the United States resume refugee and special immigrant admissions expeditiously and consistent with general travel restrictions, and the same thing that we continue to welcome asylum seekers with appropriate screening and treatment. In terms of responding to the immediate needs of refugees, and this is what you can really call your members of Congress about, first is to ensure, like Fred mentioned earlier, that there's no cost COVID-19 testing and treatment available for all. Second, to ensure that the cash payments or the tax dividends are available to all refugees, including those who have arrived most recently in 2019 and 2020, as well as individuals who filed taxes with an I-10, to be able to create a process for those who are not required to file taxes, but otherwise eligible for the payments. And to automatically, this is a really important component that we haven't talked about yet, but to automatically extend work authorizations, extend application deadlines, validity periods for visas and security checks, and authorization dates of recently expired travel documents, so that refugees who are already here and those hoping to come here don't have a snag in the process that they've already started. And then finally, as mentioned in the ICIRR platform, we're recommending that we halt the implementation and rescind the new public charge rule. Because that rule, although it doesn't apply directly to refugees, it does confuse and discourage immigrants and refugees from seeking healthcare and other public benefits and forms of assistance. So I'll enter this in the chat now, along with the phone number you can dial to call your members of Congress. You don't even need to know who they are. You just dial this number, and according to your address and zip code, you'll be connected with your representative or senators. So I encourage you to call that number 3 times and ask them to include these things in the next COVID relief package.
Thank you, Jim. Dennis, are you ready?
Yeah. So thank you, first of all, for these wonderful presentations and answers to the moderated questions. I would like to also thank our participants who have been active in the chat box, responding to each other's questions, because we want this to be a platform to share general information as well. I will start with the more general questions and then switch to the specific fact questions from refugees and refugee support program participants of our webinar about their needs. So maybe you can direct them to the resources you're familiar with. And then we will end with a group of questions about how the wider public can support the refugees. The first set of questions are about health and psychological support services. So feel free to pick up whoever is more of an expert on these questions. The first question is, what are the refugee health clinics doing to protect vulnerable individuals, immunocompromised individuals, elderly refugees, refugees with disabilities and chronic conditions? The second question is, what resources are available in the that incorporate trauma-informed care support systems for refugees who may have already struggled through immense humanitarian crisis and are still impacted by the trauma resulting from their past experiences?
Mm-hmm.
So I can speak a little bit from the resettlement perspective about how we're, trying to protect the most vulnerable. I think the question referenced several different communities, whether it's seniors, people with compromised immune systems. And right now we are making proactive, and I think that other agencies are following similar models, that RefugeeOne is making at least weekly calls to every refugee who arrived in 2019 and 2020. Because those tend to be the most vulnerable folks who are still developing language skills and still learning how to navigate systems, including healthcare and mental health care. So for those folks, we are, striving to do food deliveries, especially for folks with compromised immune systems and seniors who shouldn't be out and about. We're helping people apply for different types of benefits that they qualify for. We're trying to be really resourceful in accessing every type of public benefit that's available first and helping people qualify for those. And we're also providing non-food relief, including diapers, formula, things that families stand in need of, but that some people aren't able to access right now. When it comes to trauma-informed resources, there is a shortage of mental health resources for refugees, and it's a real need because the point of the refugee admissions program is to help refugees achieve self-reliance. And in order to do that, you really have to help refugees cope with their mental health and the trauma they've experienced. So we provide trauma-informed care, group therapy, individual therapy, psychiatric services to help refugees who are either experiencing new anxieties and mental health concerns, or who are relapsing and having previous concerns come back as a result of the new challenges. So if you know people who are in need of those types of services, you can reach out to me and I can help make a referral and see if they qualify for assistance.
Thank you. The second set of questions are specific questions from refugee and refugee support program participants. If you don't know the answers to these questions because they're very specific, just please direct people to where they can find the information. The first question is, does anyone have resources on safety protocols or support benefits in Afar language? And do you know any translators from Afar to English?
I don't know any translators or interpreters, but I'm looking now to see if I have any resources in Afar.
Okay, while you are checking that, I will ask the second question. What are the residency requirements in the CARES Act?
Oh.
Yeah, go ahead, James.
Okay, yeah, I'm happy to answer that as well. The residency requirements in the CARES Act essentially require, it's refugees that, I'm sorry, not just refugees, anybody who needs to qualify for it must have either be a lawful permanent resident or a green card holder, or meet the IRS residency requirements. And that's that they've lived in the US for at least 31 days during 2020 and a total of 183 days during the last 3 years. So essentially that means any new arrivals, any new refugee arrivals who arrived after about July 1st of last year don't meet this residency requirement.
The other question is, we have heard good overviews about the lawfully admitted refugees and their families who should be following to join. Would someone please address, beyond some of Fred's initial remarks, what the situation is for asylum seekers who are in the Chicago area but are not under Section 207 overseas refugees? For example, there has been an outbreak of COVID-19 among Central American children in a Heartland managed shelter. What is going on with people who have asylum applications pending either in removal hearings or with the asylum office? You have answered part of it, but I wanted to see if you want to address particularities of these questions.
Yeah, I can try to address. This was Susan's question, if I recall. So hi, Susan. Yeah, so immigration court is for the most part shut down here in Chicago, except for cases involving individuals in detention, and even in those cases, unfortunately, I don't practice myself, but from what I understand, these are mainly, those proceedings are mainly for purposes of bonding people out. I'm not sure to what extent, affirmative claims for relief for people in detention are being heard or processed, And of course, as I mentioned previously, people who are filing affirmative asylum cases through USCIS, all those cases are on hold as well, unfortunately. So far as unaccompanied minors being held in or being housed in shelters like the Heartland Alliance facility, unfortunately this administration has greatly discouraged potential sponsors and including relatives from coming forward due to policies that require screening of these individuals. And for many of these unaccompanied minors, the relatives who would be taking who would be otherwise offering to provide shelter for them may be undocumented and may themselves be concerned about revealing their status through a background check. So unfortunately, a lot of unaccompanied minors who may otherwise be able to find shelter beyond the facilities are still there and unable to be united with a family member or other sponsor.
Okay. We have one more question of this order, and then we will switch to the how can we support the refugees part.
We just have a couple of minutes left, so we'll have to maybe take a couple, like one or two questions.
Yeah, maybe we then switch to the specifics first, and then if we have time, we address this particular question. Is there a need for Arabic speakers, for example, to translate health guidelines? I think, Suzanne, you can answer to that.
Yeah, no, definitely. My one interpreter, case manager, he's like, stop giving me things to translate. So we really do need help in translation. So that would be wonderful. And I know for a fact that the Rohingya refugees also need help. So if anybody speaks their language, I know that they need that support as well.
Okay. And the second, our final question, unfortunately, it has to be, is what can the general public do to support refugees in the Chicago area, especially during this crisis?
Mm-hmm.
Well, I mean, I'll just start. I mean, Jim's had mentioned, we all need the support right now, and we all need the help. We're trying to stay at capacity so that we can continue our case management services and our after school, which has switched to online tutoring. So in order for us not to lose that infrastructure that we've built, and for us as a young organization, for all of that to go away is really hard to rebuild that. And so we ask for your support. And I know a lot of organizations will be asking for your support, but everybody will need that, but that's something that, maybe can plan for. We also will need volunteers, not for us, not immediately, but we will be needing volunteers in the summer and in the fall, because hopefully once we're back, we're going to need after school volunteers and summer programming and things like that. So, but we'll make those announcements later.
Okay, great. So we have only 2 minutes left. So I'm concluding the Q&A here. I will get back to some of the questions in the chat after we are done with this. So please put your email addresses in the chat if you want further answers to your questions, or send it to me privately through the chat, and I will get back to you. Thank you so much to our speakers and our
participants. Thank you, Dennis.
I will turn it over to Dalia now.
Thank you. Thank you for excellent moderating of the questions. It's never enough time. We're going to conclude the webinar. I wanted to just make sure if our speakers had any final comments they wanted to make today. Anyone have anything else you want to add before we close out the webinar?
I think we can add our contact information in the comment section in case anybody wants to follow up with one of us directly.
Terrific. And we will be having a Golden Door Coalition website, which, if you give us your emails, we're more than happy to share. Stay tuned to that. That'll probably also have a Facebook page. So stay tuned for that. I want to remind everyone that this is a regular series. Next week, we're going to be having an organization that is in many ways similar to the Golden Door Coalition, but doing their work in Toronto. So we'll have a comparative understanding of what's going on in Toronto, a very similar city in many ways to Chicago, and how organizations there are are advocating, how are they working remotely. And you know, the idea would be that if you were on this call today and you're interested in connecting with other organizations, it's a good way to connect and have a cross-pollination of ideas. You can find out more about future topics on Facebook. We've shared that link. And this webinar, in addition to all the others, if you want to listen asynchronously, the new word in all of our vocabularies, you can watch us on our new YouTube channel. And maybe Danny will repost that channel. So thank you, everyone. And I hope you have a good COVID day. It was great seeing everybody.
Be safe, everyone.
Thanks, everyone.
Bye. Thank you for tuning in.